Welcome everyone. I want to thank everyone for attending this evening, taking some time. My name is Alma Amador. I'm an ODHS policy analyst for childcare, for the childcare program. And we will be presenting a health and safety guidance recommendation this evening, and it's in collaboration with the Office of Child Care and the Oregon Health Authority and ODHS. And why don't we start with introductions before we get going? We get a little familiar. James, you're it.
Hello, James Barta, work with self-sufficiency doing stakeholder engagement.
And my name is Tammy Scott. I'm with the Early Learning Division.
Go ahead, Joanne. I'm Joanne Lindorfer. I'm with the Oregon Department of Human Services, Direct Pay Unit Manager.
Hi, I'm Douglas Lyon, a family physician, epidemiologist and one of the senior health advisors for the Oregon Health Authority.
And I'm Karen Garcia. I'm with the Office of Child Care.
Good evening, I'm Regina Seifert. I'm a policy analyst for the employment-related daycare program.
Our attendees, are you able to unmute and introduce yourself?
I'm Joy Davis, and I have a recorded preschool program, and my program's called Preschool Adventures.
Great, thank you. Welcome. Anyone else?
Well, we have two other guests, but welcome. Thank you for joining us, and I guess we'll move forward.
Okay, and I just want to make sure, just be aware that we will be provide time for questions. You can submit them through the chat box, and we will make sure that we answer those at the end of the presentation. And we will go ahead and begin the PowerPoint with that. So of course, health and safety. So the introduction of the health and safety guidance is for family, friend, and neighbor license exempt childcare providers who are caring for families receiving childcare subsidies through the COVID-19 pandemic. We want to touch base and make sure that that you're aware that these are recommendations and are not mandatory unless noted. Next slide. The spread of COVID-19. According to the World Health Organization, COVID-19 spreads in the following ways: from person to person, carried in droplets from the mouth or nose, or a person who touches a surface or object that has the virus on it, then touches their eyes, nose, or mouth. Responding to possible or confirmed cases. Have a plan for a case of COVID-19 and the possible closure of your childcare home. You should not allow children or adults in your home if they show COVID-19 symptoms. You should also not allow children or adults in your home if they've been exposed to a COVID-19 case. This is a requirement. Providers must immediately notify their local public health authority. There's the toll-free number and a local number on the screen if they have been exposed to, infected with, or show symptoms of, or are self-isolating or in quarantine due to COVID-19. You are strongly also encouraged to contact the direct pay unit at 1-800-699-9074 or through email at the DPU provider reporting at dhsoha.state.or.us.
'Cause. 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 '
responding to possible or confirmed cases, communicate about the confirmed case with help from your local public health authority, with all families and other individuals who have been in your home in the past 14 days. Sign up for OHA COVID-19 newsletter at the following website. That's on the PowerPoint. Guidance and recommendations. Drop off and pick up. Have parents drop off or pick up their children outside if weather permits. Have parents wear a face covering. Have parents keep at least 6 feet apart from others when not physically handing off a child to or from you. And have children wash their hands or use hand sanitizer right away when they enter. Daily health checks. Check the health of any child or other person, such as the parent, maintenance, etc., coming into your home. Here are some questions to ask. Do they have a fever of 100.4 Fahrenheit or higher? Have they been exposed to a person with a positive or presumptive COVID-19 case in the past 14 days? Does the person have a new loss of taste or smell, unusual cough, shortness of breath, or a fever? Family communication. Inform families of these recommendations for operating during COVID-19 and how your child care home is operating differently during this time. You're also encouraged to limit people coming into your home, even parents. Face covering recommendations, hand washing, food and nutrition, clean, sanitize, and disinfect. What you need to know. It is free. You do not need health insurance. You do not have to show proof you're an early learning provider you may be asked to declare in some way. You will receive a vaccination card or printout verifying the vaccine. It may or may not have your name on it. You must get 2 doses appropriately spaced to be considered vaccinated. Vaccine questions. Why should I get a vaccine? Vaccination is a safe, effective, and reliable way to prevent infection with COVID-19. The best way we can beat the virus is through vaccination, wearing face coverings, staying 6 feet apart, washing hands, and avoiding large gatherings. If enough people are immune to COVID-19, that will reduce spread in the community. Is the vaccine safe? Thanks to advances in medicine and vaccine development, scientists around the world have been working on new vaccines. The 2 that are licensed in Oregon have been tested on tens of thousands of people, including Oregonians from many backgrounds, ages, and communities of color. 2 federal agencies, the Centers for Disease Control, CDC, and Food and Drug Administration, FDA, have committees that reviewed all of the drug company data to make sure that the vaccine was effective and safe. The companies were required to follow people vaccinated for 2 months after vaccination, because that is when most people have side effects. Can I require my staff to get a vaccination? Currently, Oregon Health Authority does not require COVID-19 vaccinations for any group of people or in any workplace setting. Employment requirements fall under the Bureau of Labor of Industry, BOLI, B-O-L-I, oversight. For questions related to COVID-19, visit the BOLI website at the website that's listed right here in the PowerPoint. I just got the vaccine and now I'm experiencing some COVID-19 symptoms. Is this just a vaccine reaction? Most likely vaccine reaction would be fatigue, chills, muscle ache, joint pain, pain or redness at the injection site. 2, fever. 3, cough, shortness of breath, loss of sense of taste or smell. Do I still need to wear a face covering if I have been vaccinated? Yes. We do not know if the vaccine protects against transmission from someone with COVID-19 who is not showing any symptoms. If experiencing COVID-like symptoms, do individuals who have received both doses of COVID vaccine need to be excluded? Yes, they should be excluded if they have COVID-like symptoms. Like unvaccinated individuals, they should be recommended to be tested. If the test is negative, they can return 24 hours after symptoms resolve. If they test positive or do not get tested, they need to be in isolation for a full 10 days. Do individuals who have received both doses of COVID vaccine still need to quarantine if they are exposed to a confirmed case? If 2 weeks or more have passed since the individual received their second dose of vaccine, they do not have to quarantine. They do need to monitor themselves for symptoms daily for 14 days, and if they develop any symptoms of COVID-19, such as a cough, fever, shortness of breath, loss of sense of taste or smell, they need to be treated as if they have COVID-19 and be excluded. We have time for some vaccine questions, and Dr. Lyon is here to provide responses.
Hi, happy to answer any questions you have. We anticipated a few more folks, and I want to start off by thanking Alma for what a lovely presentation. I think you did all of the work. You answered all of the common questions, so it sure makes my job a whole lot easier.
Thank you.
And Dr. Lyon, this is Tammy with ELD, and I didn't know if you wanted to talk a little bit more about the slide with the person who's experiencing symptoms after having the vaccine, because I know that's something that we're hearing a lot and getting a lot of questions about. So I didn't know if you'd want to maybe review that a little bit more about what that looks like.
Yeah, if we can go back to that slide. It's important to know that when the body develops an immune response, and you can think about, getting a tetanus vaccine, or maybe when your kid got a measles, mumps, and rubella vaccine, your body in developing an immune response will sometimes develop a little fever, some aches and pains, redness at the site. The things that make us worry about COVID after the vaccine, and you have to realize this is going to be very, very rare that this happens, but it is possible, is if you not only have fever, but it comes with cough or any shortness of breath, and especially if there's a loss of sense or loss of taste or a loss of smell. Those are things very characteristic for COVID itself.
And could you talk a little bit more about the safety of the vaccine? Because we hear a lot about hesitancy and concerns around that.
Yeah, I think it's important to keep in mind these vaccines were tested on close to 70,000 people, and they were followed for a couple of months after the vaccines were given. And they found there were no deaths or serious illness in the groups that got the vaccine. However, in those that did not get the vaccine, there were quite a number of folks that got severely ill from COVID and some that died. So on the first order, these vaccines prevent disease and they save lives. And the second part of your question was, I'm sorry?
It was just about the safety of the vaccine is all.
Oh, and the safety, as I said, these were determined to be safe and effective. And if you can imagine the attention these studies got from not only the CDC and the FDA, but the World Health Organization, and on the West Coast, we even have a group of senior epidemiologists, public health folks that gave it an additional level of review before it was approved here in Oregon.
Great. Well, I'm still not seeing questions, so I'm going to continue to probe you with questions then. And participants, please feel free to unmute yourself if you prefer to speak a question rather than putting it in the chat box. You know, there's a lot of questions about, now that we have the vaccine, why do we still have to wear a mask? Can you expound on that a little bit?
Yeah, these vaccines were shown to be 95% effective. That means 1 in 20 after they get their vaccine can develop COVID with some mild symptoms and be infectious to others. The other thing, these vaccines, they measured effectiveness, efficacy, and looking for symptoms or no symptoms. And we believe it's possible for folks to have had the vaccine, have no symptoms, and maybe be a carrier for a short period of time. And it's important to remember this, you know, down the road when we understand a bit more about COVID and the response to these vaccines. Our guidelines will probably change, but we're being super extra careful now because we know that COVID can be a killer, especially for those that are elderly and those with multiple medical illnesses. So when we talk about COVID and all in the early learning division, you know, to be honest, we don't worry so much about or severe illness in kids and young adults because mostly for the most part, they'll get over it pretty quick. But it's when they go home and they can pass it to their parents and grandparents, or they pass it to someone that's working in a long-term care facility or in a congregate care setting or in a behavioral health you know, homestay environment. And it can be deadly to those folks. So our goal is to make sure there is little to no COVID circulating in community and society.
We have a question, sorry, we have a question in the chat box about kids and going back to school and how it affects them.
Yeah, you know, the studies have shown that that kids do not transmit COVID like adults. If there is a case or two, it's much less likely that they will transmit it to others, and especially if they're wearing masks and following the precautions that we recommend. We hope there will be a vaccine approved for kids next September, October. And that should be a point that after kids are vaccinated, that hopefully the recommendations from the CDC will let us all go back to something a little more normal, where we don't have to do all the social distancing. Kids can play together again and do sports and choir and music and not have to wear face masks. But I think it is good to know of, you know, the deaths, the 500,000 deaths that have happened in the United States. The vast majority of those have been in elderly folks with multiple medical illnesses, or other but younger folks with multiple medical illnesses. Kids have good, strong immune systems, and you know, if they do catch COVID, it's very, 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 very rare that they get real sick with it. But it is possible, and we would like to avoid that also.
So could you talk a little bit more? I know we had a slide about individuals who have received both doses but then are exposed to the virus and whether or not they still need to quarantine.
Yeah, and this has come out just recently. The recommendations from the CDC have stated that if you've had both doses and 2 weeks have passed, and let's say you visit your cousin's house for a meal, and then your cousin calls you up a couple days later and says, well, I just got confirmed I had COVID and you were sitting at the same table with me. Before, we would ask that you go into quarantine for 14 days. But now, if you've had both doses of the vaccine and 2 weeks have passed since you had your second dose, the recommendation is that you don't need to quarantine. However, you should keep an eye on yourself. And if you start to feel sick, first thing you should do is isolate and get yourself tested for COVID. Because 1 in 20, as I mentioned before, it has been shown that the vaccine will not work or will not prevent illness.
Right, so that's the previous slide here, that if you have both doses, it doesn't mean that you are completely unable to catch the virus. And if you're experiencing symptoms, and what kind of symptoms would those be?
You know, we talk first about the symptoms that are most characteristic for COVID, that are unique to COVID. Losing your sense of taste or sense of smell. Those things are very, very rare for other types of infections. That and developing the cough and fever. So anything like that happens, stay home, you know, call your primary care provider or your local public health department. Describe your symptoms to them and they'll arrange for you to get tested.
James, I'm wondering if we can go back to the slide about face coverings. I wanted to talk a little bit more about that, because we did talk about that even if you have the vaccine, you do need to wear face coverings. But can we go back to the slide for the guidance about it?
Is this the one?
Wasn't there when Alma was going through the guidance sections that there was a part about face
Oh.
covering?
Right, when they're, when children are being dropped off.
Right. So, you know, the guidance talks about that face coverings, even within your home, because you do have children from the outside, are recommended. It's recommended that you have children wear face coverings, but I think it's important to understand that it's never a recommendation to have children under the age of 2 wearing a face covering, or having any children that don't have the ability to take that face covering off themselves to wear one. And I can't remember if there was any other slide about it or not, but I just thought that might be an important point to bring out in the guidance, that it's definitely not for children under 2 or for children that can't take it off themselves. Older preschoolers, school age, it's not a bad idea to have them wearing it. But again, these are just recommendations. And then as the provider yourself, wearing them is a good idea also.
Great point, Tammy. Thank you for
Just
bringing
kind of
it up.
looking through
Yeah.
the guidelines to see if there's anything else that we want to call
Right.
out.
And I also want to ask our providers, did you receive a letter and a copy of this guidance? We ODHS sent it, and we're just curious to see if you actually received it. Yes, yay, great, thank you, good.
Great.
I'm glad. Whew.
I have a question for Doug. What about if a child has a parent or relative that has visited a state next to us, like California or Idaho, Washington? Is there any guidance on those persons being quarantined for 10 days? Is there any guidance at all?
Yeah, I mean, if you can imagine, it's impossible for us to make rules and guidance for every case. And, you know, this one has actually come up in the very specific case. Well, what about foster parents? And, you know, foster care is under the purview and supervision of DHS. You know, it would be prudent for folks to keep everyone at home for a couple weeks after a potential exposure. But, you know, that said, let's say someone lives in Portland and then the parent goes to Vancouver for a medical appointment for something unrelated, and then they come back across the border and then they come back home. You know, I would say there's very, very little risk they could have picked something up. However, if they went to a big meeting or a church gathering or a family reunion or a wedding, where there were a bunch of people without masks kind of close together and kind of reckless, then there is a greater risk. So you know, even though we do have guidelines that are quite strict and try to get folks, if anyone goes out of state, to kind of lock down, I would say if you want to deviate from that, you know, discuss what your risk was with your primary care provider, your local health department, and with, you know, those that are running the child care, and you know, and they can perhaps have the discussion of the risk that you were at, and if it's very, very, very low, they can make an exception.
Thank you.
You know,
I
we
do-
don't like to start making exceptions, but you know, we have to
Right.
also be a little bit practical. You know,
Yes.
you know, kids need to be able to get into school. They need to be able to get into care, and parents need to be able to go back to work when it makes sense.
Mhm. I do have a couple of comments on a few slides. So about the vaccination and being a caregiver, a child caregiver, that you won't, that you could actually bring your child care billing form from ODHS just in case they ask for it, or maybe a provider claim receipt. So it's always probably good to have that with you. And then I think there was a slide about contacting DPU is recommended strongly. And there is that, two things about that is that we're not, of course, we're going to go with the guidelines of confidentiality, but if we are receiving a report of a exposure to COVID, that we may reach out to the families involved to see if there's any additional assistance that they may need, such as our SNAP food program benefits, or anything else that they may need. So don't be, you know, worried about contacting DPU regarding that. And then the other thing was about notifying public health. I think there's a website address on that slide, and that will give you the link for your local public health department. And that's all I had.
Thank you, Joanne.
You're welcome.
Any other questions from our providers? Okay. Well, we're glad to hear that you did receive the guidance via mail. We were a little concerned that it wasn't going to make it on time, but we're glad that you did. And we're also very glad that you gave us some of your time this evening. Is there anything else that anyone else would like to ask or discuss? If not, we will let you go and enjoy your evening.
Thank you, everyone, for joining.
Yeah, thank you.
Thank you. Have a great day.
Yeah, have a good evening, everyone.
Yes. Bye.
Bye-bye.